relied on pain medication to get you through your daily struggles with neck and back issues. Are you ready to get back to even the simplest things in your life pain-free? And that's definitely the case for so many who have turned to Dr. Miller at Total Health Chiropractic. Well, many Americans are facing neck or back surgery. They don't want to have it, or they've already had it, and they still need to come see Dr. Miller at Total Health Chiropractic. So, Doc, thank you so much for joining us. And Barb, thank you so much. We'll get to your story in just a minute. I know this is something that resonates with you.
Yes.
So what do you say to that? All these people going through these surgeries?
Well, the struggle a lot of people have when they have chronic neck or back pain is that the treatments that are recommended commonly just involve masking those symptoms. You know, it could be drugs, shots at the pain clinic. And as you said, a lot of times they have to resort to neck or back surgery. And most of the time these treatments are just sort of masking or covering up the pain. They're not really fixing the cause of the pain. And, you know, there's a lot of side effects and risks that go into these treatments that people have to be concerned with. And, you know, if the thing they're looking for is to get their life back, get rid of that pain once and for all, you have to work on fixing the cause of the pain, not just keep masking it if you want long-term relief. And so we see all kinds of patients in our office, but unfortunately a lot of them have already resorted to those treatments, Barb being one of them with back surgery. And I mean, they're talking rods and screws in the back. It's very invasive. And the problem with fusions in the spine is that the stress gets distributed around that fusion. And even if they do get good results in the beginning, it tends to not last very long because the stress gets pushed around that fusion. And then the areas right around it wear down very rapidly and become a problem. So usually if people start with one back or neck surgery, it won't be their last.
Absolutely. So like we said, you kind of see people on both sides of that fence. You're trying to get people to avoid that, or you've seen the people that have already had it. So what machine do you have here, or an approach that you can offer to these people that's had some great results?
Sure. Well, what we offer here, Leanne, is called true non-surgical spinal decompression. We use a machine called the DRX 9000C. This is a medical device that's used to heal and repair and regenerate these injured or damaged discs. So if people have bulging or herniated discs where they're pushing out into the nerves, this machine's able to retract that back in off the nerves. And if the discs are degenerated and thinning down, it rehydrates these discs where they get thicker. It's a non-invasive treatment, so there's no drug shots or surgery involved. And what's great, when people have a fusion with spinal decompression, it's very specific, so we can pinpoint areas right around the fusion and not target the fused area, but work around it. So it's a very safe and effective treatment, and we actually work on fixing the problem. We're not just temporarily masking the pain.
And before we talk to Barb, why don't you go talk about her condition, how she came in, and then where she's at now?
Well, I mean, Barb can speak for herself too, but I would say, you know, she was struggling when she came in, and she had tried the medications, physical therapy. She did have fusions in her lower back, and then she also had pain stimulators implanted to hopefully not have her feel the pain as much. But she had trouble getting around. Balance was an issue for Barb, and, you know, we took x-rays and looked at her images. I think you'll show that to your viewers. You know, she had a lot going on, but because we can go so specific with spinal decompression, we worked right around that fusion, the areas that were now a problem, and able to get those resolved. And I think she's very happy with her results.
So Barb, thank you so much for joining us today. Before you went through all the treatment here, talk about your pain and how it affected you.
Oh my, I had such terrible pain. I could hardly get around anymore. Couldn't empty my dishwasher. It always seemed like it just was too much for me to get along. And we saw the doctor's ad, and we came in, and I think we joined right the very first day. So we were very pleased, and I am very pleased. Then we got in an accident and kind of set things back just a little bit, but we're on the road now, so we're good.
You're doing good. Well, talk about, you've had surgeries, and kind of give us a little history of your back condition.
Oh my, I had a back surgery, and then I was, you know, taking all the pain pills and everything like that. Then I started getting the shots, and then I had the stimulator put in even, and nothing helped it until I got to Dr. Miller.
What do you think your pain level was like every day?
Oh, like 9 or 10, every day, every day.
And how long was it like that for? How long did you live like that?
Many years, trying everything.
Let's talk about your quality of life now, emptying that dishwasher and doing the things that maybe you took for granted.
Oh my, and vacuuming and dusting, everything was just such a chore. My house is cleaner now.
And it's the DRX that you credit that?
Yes, I loved that machine.
What would you say to somebody that's maybe watching that's lived in your shoes before?
Just call, make an appointment, and get over here.
And you also have a new patient special in an upcoming webinar that you want everybody to know about.
We do. So, because of COVID, we can't do in-person seminars, but Tuesday at 5:30 p.m., we're going to be offering a webinar where I'm going to talk about a lot of these different conditions your viewers may be struggling with, talk about spinal decompression and how it might be a solution for them. If they can't make the webinar or they're just in too much pain and don't want to wait, they can call our office today, and for $60, we'll do a consultation and a physical examination. We're also going to throw in 2 x-rays so we can actually show the patients what the problem is that's causing their pain and start working on solutions so they can start enjoying life once again, pain-free.
Absolutely, and that's a bottom line right there. Quit living in pain when you don't have to. Come see Dr. Miller at Total Health Chiropractic.